Hi friends, let's talk about the 10 things you should know about abdominal pain. It's something we all experience from time to time, but there are certain signs and symptoms you should never ignore and seek medical attention. In the end, I will tell you how to recognize an infection that actually infects over 50% of the world's population and can cause 90% of ulcers. Number one is a perforated ulcer. These can be serious and sneaky. Oftentimes people will have pain and fever, and then suddenly there's a brief period of relief with no pain right before things crash. It's crucial to recognize these warning signs to go see your doctor early. Number two is appendicitis, which may start as a vague discomfort around your belly button and then localize to your right side. I actually had appendicitis, and the pain gets worse, and it is often accompanied by nausea and vomiting. Please see your doctor if you have abdominal pain that lasts over 30 minutes. Number three is colon cancer, which is on the rise, especially in younger people. I've seen people in their 20s with colon cancer, and unfortunately, colon cancer is silent and can go undetected until it reaches stage 3 or 4. This is why a screening colonoscopy is important. Did you know that the screening age is now 45? But even younger people, like I mentioned before, have been diagnosed and they are more aggressive with advanced cancer. Colon cancer can present with nonspecific abdominal pains, bloating, and unintentional weight loss. Number four, if you're feeling full and eating less and you're losing weight without trying, that could be a sign of stomach cancer. Keep in mind these symptoms are nonspecific and many things can cause these nonspecific symptoms. However, a procedure called an EGD is helpful to make a diagnosis because they need to do that to look at the insides of your stomach. Number five is actually difficult to diagnose early, and that's pancreatic cancer. Steve Jobs, Ruth Bader Ginsburg, and Patrick Swayze all died of pancreatic cancer. Pancreatic cancer, however, can show up with vague symptoms in the abdomen for years, including random abdominal pain and nausea. Unfortunately, those who get jaundice already have pretty advanced disease. Number six is inflammatory bowel disease, which is another cause of abdominal pain, often accompanied by bloody diarrhea. Number seven is an infected gallbladder, which oddly can have pain starting in the right shoulder and eventually move to the right upper abdomen. And this is because the nerve that is close to your gallbladder, the phrenic nerve, also stretches to your shoulder. Number eight is a perforated diverticulitis. This can present with lower abdominal pain with or without constipation, and some people have diarrhea. Number nine is a ruptured spleen, and this can happen in people who have had some kind of trauma, like a forced blow to the stomach, or a car accident, fist fight, or contact sports injury. Those who have enlarged spleens, like from mononucleosis, can have mild trauma to cause the spleen to rupture. A ruptured spleen is immediately life-threatening. If your spleen is ruptured, you may have pain in the upper left abdomen, and it will be tender to touch there. You may have left shoulder pain, and you may also become lightheaded. Number 10 is a really common cause of ulcers, and most people in the world don't realize they have it. This is a bacteria called Helicobacter pylori or H. pylori. This can cause chronic abdominal pain and nausea. However, left untreated, this infection can cause ulcers and stomach cancers. It's important to see your medical doctor if you have any concerns, especially if you have symptoms that never go away. Early diagnosis is the key to prevent complications and maintain your health. And if you want to learn more about symptoms to never miss, watch the next video.